Hello, I'm Dr. Michael Steele and welcome to today's YouTube video. Today I'm going to be going over how to read your lab reports through the wonders of modern internet technology. We now have the internet portal available if you are a patient in our office, and through that you can review your own lab results as soon as they're available, often the same day as you had your blood drawn. And that's a handy feature for a lot of patients. They like to take advantage of it. Unfortunately, the reports don't come with any interpretation, so it can be a little confusing if you're not sure what to look for. So it is sort of a running joke in our office amongst the doctors that, we keep having people call because their MCHCs were high. Ha ha ha. So funny if you're an internal medicine doctor. So actually it's not even really funny, even for an internal medicine doctor. If you called in because your MCHC was high, don't feel bad. A lot of people do it, and only a doctor would know that what to do with that kind of information. So that's why I'm making this video, so you'll know. So let's get started. So here's a set of labs that may be very similar to what you see if you pull up your labs on your net portal. This is a set of labs from a very fine physical specimen. Just kidding, it's just my labs from a couple years ago. And I chose these labs because these are basic ones that internists are checking all the time. These are basically like vital signs to us. So if you came into our office with a hangnail, you're probably going to get these tests drawn just to make sure we're not missing anything. You may be able to deduce from the clever numbering system that there are 3 separate batteries of tests on this particular form. Number 1, we have the complete blood count, which is up here. This is a measurement of the cells that make up your blood. So your white blood cells, your red blood cells, and also your platelets. The second battery of tests is your complete metabolic panel. This is a measurement of things in your blood that are not cells, just kind of floating around, so things like electrolytes and proteins. This is actually a combination of 2 smaller batteries of tests. The basic metabolic panel, which is your electrolytes, kidney function tests, and glucose, and then the liver function tests, which mysteriously measure your liver function. So this third set of tests, your lipid panel, this is just a fancy way of saying it's your cholesterol test. So why don't you just call it a cholesterol test? Well, we can't do that because technically one of the measurements is not a cholesterol or your triglycerides. So we can't call it that. We got to call it a lipid panel. Yeah, kind of dumb, kind of inattentive, but internists are just kind of that way. At least good ones are. Before I get too much further, I just want to point out that this column over here where my mouse is moving, this refers to the names of each of the individual tests. This column right here is the actual measurement from your blood, and this column over here is the normal ranges. If any of the blood tests are outside of the normal range, you'll be preceded by this little L if it's too low, or an H if it's too high. So if you see an L or an H, do not panic. It does not mean you're going to die of cancer, or it does not mean you're going to die of the world's worst case of whole body herpes. At least usually it doesn't mean that. In the CBC, the first number you should be worried about is this number, your WBC, which is your white blood cell count. This is a measurement of the blood cells that make your immune system and help you fight infection. The second set of numbers you should be worried about are these numbers right here, your hemoglobin and hematocrit. These are a measure of your red blood cells, more specifically the ability of your blood to carry oxygen. So if that number is low, you develop anemia. The next most important number would be this one, your platelet count. Your platelets are little teeny blood cells that help your blood clot so that you don't exsanguinate every time you have a paper cut. Generally speaking, as long as those numbers, your white blood cell count, your hemoglobin, hematocrit, and your platelets are normal, most of the other numbers in your CBC don't count, generally speaking. So just so you know what these other numbers are talking about though, the MCV right here is your mean corpuscular volume and refers to how large your red blood cells are. This number up here, your RBC or red blood cell count, that's the actual concentration of red blood cells within your blood, but it's less useful because what we really care about is oxygen carrying capacity, and your hemoglobin and hematocrit are better measurements of that. RDW is your red blood cell distribution width. That refers to the variability in the size of red blood cells and can be useful sometimes when we're trying to figure out why you're anemic. Similarly, MPV is your mean platelet volume and refers to the size of your platelets, and again can come into play in certain rare platelet disorders. These numbers down here are the differential for your white blood cell count, meaning it breaks down your white blood cells into its component parts, lymphocytes, monocytes, granulocytes. This can be useful when we're trying to figure out why is your white blood cell count elevated or low. There's 2 numbers here, your MCH and your MCHC. These are your mean corpuscular hemoglobin and your mean corpuscular hemoglobin concentration. These numbers refer to how much hemoglobin is within each individual red blood cell, and I am not aware of any significant medical diseases that depend on these numbers or are diagnosed by these numbers being abnormal. So we basically ignore them because they're not important. So that brings us to the complete metabolic panel, which measures a wide variety of things within your blood. Number one here is your glucose. That's basically sugar. And if this number is elevated, it could be an indicator of diabetes if it was tested in the fasting state. If it's non-fasting, this number is often elevated and can be completely normal. Does not mean you have diabetes if you were not fasting. The next two tests here on the list would be your BUN and creatinine. These are your kidney function tests. The creatinine is the more important of the two, and it actually goes backwards from your kidney function. So the lower the number, the better your kidneys are working. If that number goes high, your creatinine, that means your kidneys are starting to slow down. So these next 5 tests are your electrolytes, your sodium, potassium, chloride, ECO2 is just a shorthand way of writing bicarbonate, and then calcium. The next 6 tests here are your liver function tests. So your protein, albumin, bilirubin, AST, ALT, and alkaline phosphatase. Now, even though they're called liver function tests, there's many other things that can affect these levels. Now, any one of these numbers in the CMP, they all fluctuate day to day, hour to hour. It can often go in and out of the normal range. So just because you have a slight elevation of the numbers or a slight low number, as long as you're feeling well, I would not get your undergarments in too much of a bunch before you talk to your doctor. Lastly, that brings us to your lipid panel. So the top number is your total cholesterol. In the old days, we used this to screen for cholesterol first, and if it was below 200, we didn't get too worried about it. But now we look more at your HDL and your LDL. Your HDL is your good cholesterol. You want that number to be higher. The higher, the better. Normally, we like it to be over 35. So you can see my HDL is a little bit wimpy here because I need to exercise more. If you get over 65, you get kind of extra bonus points. Your LDL here is your bad cholesterol. That's the one we're always trying to get lower. Your triglycerides are the thing here that is not cholesterol. Triglycerides basically refer to straight fat that is floating around in your bloodstream. And you like that number to be lower as well. Your non-HDL number here is a backup number in case your triglycerides are high. Because it turns out if your triglycerides are over 200, that LDL reading is not accurate. Because it's actually not even a reading, it's just a calculation. And the calculation gets all screwed up if your triglycerides are elevated. So non-HDL is used to approximate your bad cholesterol when your triglycerides are too high for the equation to work. And then very last, we have your total cholesterol to HDL ratio. And the lower this number, the better. I'd like to wrap this up with a few more thoughts about these blood tests and actually about blood tests in general. And instead of forcing you to look at my ugly mug, I'm just going to leave you with this picture of a sunset. This is from my younger days when I was in the Navy, and this is from cruising around in the South Pacific. It is absurd how many awesome sunsets you get when you're underway in that part of the world. It's crazy. Very beautiful. Now, if you go back and look at those blood tests, you'll see that if you combine all those batteries of tests together, you have 36 different tests that are listed. Now, 8 of those admittedly are calculations, but that leaves still 28 separate measurements that are performed just by doing those 3 basic tests that we order all the time. Now, the way that the reference ranges are determined, generally speaking, is based on the bell curve, where the middle 95% of the population is going to be in that normal range, but then that leaves 2.5% of the population is going to be too high and 2.5% of the population is going to be too low, even if they're completely normal. So that means your chance of having an abnormal test, even if you are a completely normal person, is 5% for each one of those separate measurements. Now, if you think about that, if you have a 5% chance of having an out-of-bounds reading on any one test, your chance of having 28 separate measurements all be within normal range is actually quite low. So just keep that in mind when you get a little high or a little bit low reading on your test. Don't freak out. Be sure you talk to your doctor about what it means, because it could be you're just completely normal. So I do hope that that information is useful for you and will help you navigate your basic blood test a little easier. Until next time, take care.